Hello people, this is Dr. Muskan this side, and yesterday on ICU Rounds I really enjoyed a lot and I have gathered many points during rounds, and I am going to share 11 best points with you. The first point was there was a patient who was having one episode of seizure. So sir thought in the line that this patient also has some brain injury. So this was the very nice point which I have got. He patient was conscious, but might be he in hypoxic brain injury. Okay. The second point which I really liked was the one patient was there who was having bilateral crypts. So he asked very different question. He said, what is the reason of the presence of the crypts in this patient? And I said, might be fluid overload. He said, what all other reasons are there? And I was like, all bhi reasons hote hain kya? But yes, I found out one more, that was collapse of lungs. Okay. The third point is there was one patient uh, who was given dextrose solution, and sir said the sister that don't stop the dextrose solution immediately, otherwise there might be rebound hypoglycemia. And to my consciousness I was really asking, what is rebound hypoglycemia? Let me tell you what it is. When blood sugar level drops overnight, body hormones works against insulin. That means there will be too much sugar in the morning. डू अंडरस्टैंड दैट कि अभी तो बाहर से ग्लूकोज जा रहा था, अब हमने बाहर से देना बंद कर दिया तो ग्लूकोज का लेवल ओवरनाइट बिल्कुल कम हो जाएगा और हमारी बॉडी अगेंस्ट इंसुलिन एक्ट करने लग जाएगी. तो इंसुलिन क्या करता है, ग्लूकोज को कम करता है, तो नेचुरली ग्लूकोज क्या हो जाएगा, बॉडी में शूट अप हो जाएगा. तो मॉर्निंग में हमें क्या मिलेगा उसमें, hyperglycemia. And what are the symptoms of the hyperglycemia? Confusion, shakiness, anxiety. And how we have to prevent hyperglycemia, rebound hyperglycemia? Eat small meals in between. Okay. The next question was, there was one patient of postpartum eclampsia and sir told might be इसको हेल्प सिंड्रोम हो. सो मैं तो भूल गई हेल्प सिंड्रोम, मैंने अपने यूजी में जब पढ़ा था, तो आई जस्ट रिवाइज इट वंस. HELLP. तो H stands for hemolysis, जब bilirubin का level more than 1.2 mg per DL हो. EL stands for elevated in liver enzymes, SGOT and LDH. LP stands for low platelet levels, that is less than 1 lakh. Okay. The next point is, there was one patient whose PCO2 was 108, and after giving amylophyllene infusion, it dropped down to 63. So sir told bronchospasm component was taken care of. What is bronchospasm? That is hyperreactivity of airway. Next point was, one patient was there who was having deranged AKI, and due to which her GCS was low. So sir told very nice word, that was metabolic encephalopathy. So I got that. Next point was, what is the difference between inotropes and vasopressors, which are most commonly used in ICU? Inotropes are those drugs which tell the heart muscle to contract with more or less power, and vasopressors are those which constricts the blood vessel. So inotropes is something related with the heart muscle, and vasopressors are related with the blood vessels. And inotrope drugs are your dobutamine and dopamine, and vasopressors are your NORAD and adrenaline. Next point was, there was one patient who was having obstructive jaundice. So when sir came around, he said कि obstructive jaundice है, melena present है, तो melena has been started with some point, and अगर melena है तो AFI ज़रूर होगा. And he literally shifted the notes over there, and he found out that yes, AFI is present, enteric fever is present, and he specified to his students that you have to think from the starting point of the disease, and which really give me a kick that yes, I have to do this when I have to see the patient. कि अगर melena present है, melena is your blood in your stools. So it started with your enteric fever to obstructive jaundice to ascites. And he said कि अगर ऐसा flow चल रहा है disease में, ऐसा pattern चल रहा है, तो the answer for it is your acute hepatitis. So next point was, there was one patient when we were on rounds, the lady, her heart rate increased to 183, and sir simply told कि just start giving injection adenosine, and check potassium and magnesium level. And after I was observing that her heart rate dropped down to 160 to 150 to 100, and he told that this is supraventricular tachycardia, which is present generally in the patients of CAD. And he told that the management for it is your adenosine, your beta blockers, and your calcium channel blockers. And injection adenosine is a very good drug which helps us to differentiate between supraventricular tachycardia and infraventricular tachycardia. And he also given potassium supplements from the outside to maintain her hypokalemia. And what has happened basically, initially he said pot phos, and I was like, why he didn't choose KCl or your pot chlor? Then I discovered that in potassium KCl ampule there is only 20 milliequivalents of potassium, but in pot phos in one ampule there is 60 milliequivalent of potassium, so we can treat the patient with only one ampule. Otherwise, if we have to give KCl, we have to give 3 ampules of it. And that was a point which was making me feel good. Finally I discovered this, because many patients are there in ICU and hypokalemia is generally present. So the treatment for it is KCl, pot phos, or pot chlor. And which medicine is decided, which antibiotic is decided for which patient injection, sorry. So that was something good to know. So another patient was there in which his trachea was shifted to the pathology side. So sir asked what are the DDs. So one was fibrosis, another was collapse of lung. And what are the DDs if trachea is shifted opposite to the pathology side? One is pleural effusion and another is pneumothorax. Other question was, there is a presence of blood glucose more than 250 mg per dl, severe metabolic acidosis, pH is your less than 7.3, bicarbonate is 18 milliequivalents per liter, there is ketonemia or ketonuria present. And sir said that this patient has TKA, might be HAGMA, and this is euglycemic ketoacidosis. I was like, what is euglycemic ketoacidosis? Then I discovered that blood glucose ka level should be less than 250, ketonemia that or ketonuria is present, or there is severe metabolic acidosis. And this occurs because of 3 reasons. One is SGLT2 inhibitors intake drug, second is a pregnancy, and third is a prolonged fasting. So yeah, that lady was on SGLT2 inhibitors, which we have stopped to treat this euglycemic ketoacidosis. One term was MSSA, which he told, and I was like, यार मैंने MRSA सुना है, what is MSSA now? So there is a basic difference between two. MRSA is resistance and MSSA is your sensitive. And that's all. I really enjoyed yesterday on ICU rounds, and what all knowledge I have gathered I have shared with you. I hope you have also get the kick feeling which I get after reading these points. And that's all. Dr. Muskan Bansal is signing off now.